Well, let's bring in now Dr. Mohammad Subeh, who's an emergency room physician and joins us live from California. Dr. Subeh, thank you very much for your time. You've been there in Gaza, is that right? For a number of weeks, you were there recently. Just how harrowing is what you witnessed there?
Yeah, thanks for having me. I just returned from a 5-week medical mission where I served in a field hospital we set up on the border of Khan Yunis and Rafah. Um, you know, uh, there's only so much that the pictures and videos that we all see on the news and social media can relate to us as human beings in terms of the magnitude, the catastrophic levels of traumatic injuries and atrocities that the Gazan population is enduring right now. As an emergency physician, nothing could have prepared me for what I saw during my 5-week medical mission. There's a disproportionate amount of children, young people that are targeted deliberately via gunfire, missile attacks. And there's a huge ripple effect on multiple generations of Palestinians in terms of the health impact that this is going to have. Many of the patients that I treated had lost their entire families. Some of these are, as young as 17 days old. Seeing children with gunshot wounds to their chests, to their heads, is not something that I've ever encountered. And I've trained in, facilities with high penetrating trauma rates, but nothing to this magnitude. When I left in the past week, we were seeing an uptick in severe malnutrition. There's a deliberate starvation now. So if people are not being killed via missile attacks and gunfire, they're being deliberately starved to death. People are dying from infectious disease, whether it be respiratory infection, gastrointestinal infections. People are being pulled out of the rubble only to then be killed in front of their family members. And so the physical and mental trauma that is being endured for now over 6 months by the Palestinian people in Gaza is not only inhumane, it's bewildering that we as a human population on this earth in this time are allowing it to happen in front of our eyes. It's very difficult to work in these conditions, obviously, as an emergency physician, but also with the limited supplies, equipment, medicines that are allowed in for us to be able to do our job to save lives and save limbs. Everything's being stopped at the border. And so something's got to give in order to allow the people to survive this.
You mentioned there limited supplies, medicine, medical supplies. The Al-Shifa hospital itself is still under siege by Israeli forces. The WHO, Dr. Subeh, says a hospital must never become a battleground. What's your response?
I think that's a no-brainer. I think that should be common sense for anyone and everyone on this earth. There are certain places that should be off limits to any fighting, any killing, any siege, because these are lifelines for civilians who are trying to escape being killed in terms of whether they're internally displaced and seeking shelter there or seeking care for their traumatic injuries, their medical emergencies, delivering babies. These should be off limits, and we kind of all know that. The problem here is more so that there's a double standard in the world right now in terms of where and to whom these humanitarian laws and international laws apply. And so as soon as you have this unequal balance in terms of these laws, it kind of begs the question of the validity of the application of these laws and whether or not the mechanisms in place are sufficient to ensure the enforcement of these laws. And what does that look like? Because, only a few months back were we debating, was there, did Israel bomb this hospital? Did it not? Right now, only a handful of hospitals are functional and open in Gaza. Only about 12 are operational. And really, running on fumes. And so it's really not a question of should hospitals be off limits. It's how do you make sure that that is enforceable across the board for every entity on the face of this earth.
Dr. Subeh, it is, as you mentioned earlier, it is the children who are bearing the brunt of this war. I'm a mother myself. Are you a father? And even if you're not, how have you dealt with the trauma of seeing what's going on a daily basis to these children?
I didn't realize the level of impact that seeing dead children constantly, day in and day out, would have on me as a human being, and especially as a father of two boys. It's very painful to see a lifeless, dead baby's body in front of you. To hear the screams of crying babies that have come to us without any family, many of whom lost their families under the rubble. To see a child my son's age be shot in the chest. To take care of a 15-year-old young man who, with his limbs blown off, completely on the verge of death. Not only does that pull your heartstrings as a human being at how unjust that is and how frustrating it is that the world has stood idle and allowed this to happen, but also as a father, there's this intrinsic paternal instinct of trying to take care of your children. And I felt that with every child I took care of in Gaza, consoling them and trying to give them a hug. I know that only did so much for them in that moment, but there's this feeling like you want to take care of them in every way possible and try to make things better for them, only to realize that they're all in this petri dish, this concentration camp, targeted constantly at every hour by missiles and starvation. And it's very hard. It's very hard as a father to see that. And it made it that much more significant for me and precious when I came home and I hugged my boys and I held them very tight. And I felt sad that many of these children no longer have their parents to be able to hold them and console them.
Dr. Subeh, we'll leave you to enjoy your time with your family. Thank you very much for speaking to us here on TRT World. Dr. Mohammad Subeh there, live from California.